I suppose that this is an important conversation to have, especially at a time such as the unprecedented time of COVID-19, where medical experts have expressed concerns that there seems to be some sort of ignorance when it comes to HIV and AIDS during a time like this.
You're right, Mpho. We've heard this from health officials saying that they're really concerned that as the country fights the coronavirus pandemic, issues around HIV, AIDS and TB will be forgotten as, of course, we try and get more people in the country vaccinated, and especially around the world as well. But Mpho, it is a really important day. We know that the Deputy President, David Mabuza, in his capacity as the chairperson of the South African National AIDS Council, is expected to launch the SANAC Private Sector Forum. And of course, they are now will be bringing on board more stakeholders in the private sector in their fight and efforts, in terms of the fight against HIV, AIDS, TB, as well as STIs. But just to tell us more about this launch, Mpho, and why it was so important to have such an initiative, we are joined by Zor. He is, of course, the Secretariat for SANAC. We are here today, sir, here at the Sandton Convention Center. You are launching this private sector forum. Why was there a need to do so?
We are very excited as SANAC today, because we have been hoping and working very hard for this day to materialize. SANAC has got is a partnership of 3 sectors, bigger sectors, that represents the totality of the South African society, because HIV, STI and TB actually affects the whole of the South African society. And we have got government, which has got its own forum called the Interministerial Committee. We have got civil society, which has got its own civil society forum. We have got the private sector. And even though the private sector has been there on paper in terms of SANAC governance structures, it did not have its own forum that actually coordinates the private sector and makes sure that they strengthen the response from the private sector perspective. So we worked very hard. We actually had a strategy developed, and from the strategy we had consultations. From a lot of consultations we had elections. So the private sector now has got the leadership, which is going to be announced today by the Deputy President, and we now have a forum in the private sector. So in many respects it really completes the whole SANAC sector family. We had a missing link, which was the private sector, which was not there in terms of the governance structures and leadership. Today we commemorate celebrate the fact that now the private sector has come fully on board.
What challenges did you encounter as SANAC where you didn't have a forum of this magnitude, especially in the private sector?
I think, as you may be aware, the private sector very often it's a very, very large grouping in South Africa itself. And what we also know about the private sector is that it is built primarily on competition. So one of the challenges is to try to get the people who are actually operating on the platform of competition to begin to come together and see a bigger picture and collaborate together to set up this particular forum and agree to work together to strengthen the response to the benefit of the whole of South Africa. I think COVID has actually taught us that even as much as we may differ, even as much as we may compete, there are certain issues, especially issues of health, issues of the welfare of the community, where we have to bury all our differences and come together and work together. And in that way, we all have a common destiny.
Which businesses will SANAC be working with in this forum?
We are working with all the major business formations, the formal and the informal, your Mabuza, your BLSA, and you know that these associations, business associations, also have got their own various members that are there. You know, you have got your various sectors in business, your mining sectors, your financial sectors. They are all under a number of associations. But what is very heartening for us is that we also have in the forum the so-called informal business sector. You also have the Waste Pickers Association that has come on board. And sometimes in the private sector, the people who really need the support in the areas of welfare, in the area of health, are those people in the informal sector. So they are also on board, and we are very excited about it.
And when you look at the business sector, what will be their role in this forum?
I think the most important issue is to make sure that the HIV, STI, and TB agenda is there at a leadership level where it matters. And we do expect coordination within the business sector so that they can expand the private sector response. In other words, when we expect government to respond, when we expect civil society to respond, we also expect the private sector to expand their own response. But there is also another issue which is very important for us, especially at SANAC, is the issue of resources. As you know, government puts a lot of resources into the response. We have got donors who put in billions into the response, also through people like PEPFAR, your US agencies, your Global Fund. But we would also like to see business putting more resources into the response, especially when we look at their corporate social investment budgets themselves. We expect them to be able to resource the response more. And we believe that when business actually plays an active role and expand the response and begin to be more involved, especially in the areas where they have got a footprint, then there is no doubt that we are going to be able to reach the 2030 goal of eliminating HIV as a public health threat by 2030.
Reverend, when it comes to where we find ourselves now in a country like South Africa and the rest of the world where there is the fight against the coronavirus pandemic, how much of an impact has that caused in the fight against HIV and AIDS and TB as well as STIs?
When we do a little bit of assessment, we definitely, as with many other issues, we think that there has been some gains that we had that have been reversed by COVID. But we are not really complaining about it. We're saying that there are also lessons that we can learn. And one of the biggest lessons that we have learned is the way we have seen massive mobilizations of South Africans and the unity of purpose coming together to try and fight this scourge of COVID. So we believe that those kind of energies, those lessons, we can recapture them back into the HIV, STI, and TB response. And of course, there is a lot of similarities between COVID itself and HIV and TB in particularly. And we believe that we can be able to get lessons. We actually draw lessons from our fight against HIV and TB for COVID, but we can also draw great lessons in terms of our recent fight against COVID for STI, TB, and STIs, and HIV.
Thank you very much, of course, for that is Reverend Zwo. He is the Secretariat for SANAC there, just talking about, what to expect when it comes to the launch today, where the private sector will now begin to be coming on board, and they will also be playing their role when it comes to the response and the fight against HIV, STIs, as well as TB.
Very well, let's leave it there for now. Of course, we will continue to get updates throughout the course of the day. Our reporter Mbali Thethani at that launch, SANAC launching the private sector forum.